Okay, hello everybody, and welcome to your next set of online recorded lectures. So I'm going to begin today by revisiting our teaching and learning plan. So I've pulled it up on the side here, and I just want to touch base on where we're at in the course and some upcoming assessments. So this week we are going to be looking at organization of the body. Just a reminder that your quiz 1 is now available as of right now, and it is due by tonight at 11:59 p.m. So this quiz is based off of the material from week 1 and week 2, as mentioned in the announcement that was posted. A little reminder for those of you who have a LOA or letter of accommodation and are interested in activating your accommodations, please do email me prior to the assessment. This doesn't occur automatically in Brightspace, and I'd just like to verify prior if the individual actually wants to activate their accommodations for the given assessment. So please do send me an email prior if you are interested in activating your accommodations for that quiz. You can also let me know if you want them activated for every assessment, and I can apply that ahead of time now. So just please reach out to let me know and to verify that that's what you want to do for the assessments. But other than that, this week, as I mentioned, we're going to be looking at organization of the body. The quiz is based off of basic word structure and medical terms associated with cancer. And as you can see, the quiz is available again today, and it will be due by tonight at 11:59 p.m. You have 30 minutes to complete the quiz, so be sure to start it before 11:30 p.m. to allow yourself with the full half an hour or however much time you're allotted to complete the quiz, based on for those with an LOA. Okay, so something else I want to mention just to keep an eye out for. So next week you have another worksheet, so this will be really good practice. And the week 5, we have our first test. So test 1 is worth 20% of your final grade. And similar to the quiz, it will open up on the Tuesday morning, and it will be available until Tuesday evening at 11:59 p.m. So you'll have to submit the test before them. The test is scheduled for an hour. I'll post the details of the test closer, probably at the beginning of next week. But it's 1 hour, multiple choice questions as well. But I will post all the specifics of that as we get closer to the date. And if you have any questions or concerns about any of these things, feel free to reach out and let me know. So I'm going to now switch over to the slides for this week. I'm just going to take a moment to change the view here. Okay. Alrighty. So a couple of other reminders, just a reminder to keep updated on our Brightspace page. This is where I'm going to be posting all announcements as you've been seeing. So updates about the tests and the quizzes will all be posted here, and reminders of the practice activities. So I'm going to reshare my screen here. Okay. So as I mentioned, this week we are looking at organization of the body. Oh, pull up PowerPoint slides here. Awesome. Okay. So in terms of organization of the body, we're specifically going to be investigating some directional terms. So how we describe the location of particular structures. And let me just do current. Okay, there we go. So how we are able to describe the location of particular structures in the body, the location of body cavities and organs within the body cavity. So we're going to talk about what the body cavities are and describe the organs within. We're going to talk about the divisions of the spine and the anatomical significance of the divisions of the spine, distinguish between the three major body planes, so how we are able to kind of identify the planes in space where we can see cross sections or views of the body. This is particularly relevant for things like CT scans or X-rays, and also locate organs of the abdominal region. So be able to describe the location of a specific organ in the abdomen or in the other body cavities. So before we begin, I want to do a quick little exercise to basically quiz our understanding of the previous units. But these particular component parts are going to be really relevant for today's lecture. So I'd like to start with some practice on decoding some anatomical terms, understanding location-based information, which is largely going to be the emphasis for this week is on location of structures. And therefore, you can take a minute to pause the video and consider the following. What does peri mean? What does the prefix hypo suggest about location? So what does the prefix hypo suggest? And also, what does the prefix epi suggest? So I'll have you take a minute to pause the video, consider the answer to each of these, and then I will take them up. Okay, so hopefully you paused the video there. Now, let's begin with what does peri mean? So peri refers to surrounding or around. An example that we're going to see in today's class is the pericardium. Sorry that my writing is not the best. So the pericardium refers to surrounding the heart, or it's specifically the structure or membrane that surrounds the heart, the outer layer of the heart. So it wraps around the full heart. And we're going to talk about the body cavity that's a part of today and its anatomical significance. Hypo, as we know, is the prefix meaning below or under or less. So hypodermis is an example that we use. The hypodermis is the lower layer of the skin. Epi refers to above or higher than. So the epidermis is actually the most superficial or highest layer of the skin. So these prefixes provide us with some sense of direction and location to be able to describe a particular structure in terms of its location, where it is in the body, and also some directional information as well. So let's begin by talking about the body cavities. So the body cavities are fluid-filled spaces in the body that house and protect the internal organs. They allow for organ movement as well as function, and their location is related to function. And this relationship is really relevant in diagnosis, imaging, and surgery. So having awareness of the location of the body cavities, of course, gives us an understanding of where particular organs and structures are in the body. And this helps us with performing diagnostic imaging to be able to visualize the internal environment in the body, with surgeries. And also, we'll talk about how the cavities and features of the cavities, how they allow for organ movement as well as function. And we'll talk about how the cavities specifically that surround the lungs and the heart are able to support the function of the pumping of the heart, for example, by being filled with fluid that really protects the organs, reduces friction as the heart contracts. There's fluid surrounding the heart and within that cavity to aid in its movement and its function. Now, the body has two main cavities. One is the dorsal cavity or the posterior cavity, and the other is the ventral cavity or the anterior cavity. So ventral and anterior are referring to the same thing, and dorsal and posterior are referring to the same thing. So for the dorsal cavity, it is the more posterior or back surface of the body. Think like a dorsal fin on a marine animal. So the fin is on the back of the body. So dorsal is for posterior. Ventral is the anterior or front surface of the body. So structures that are closer to the front or the anterior side of the body. Now, directional terms are essential because they avoid confusion. So these terms that we use, they're universal and they're unambiguous. So they're very precise and specific to the location of a body structure, regardless of the patient's position. So whether a patient is standing, sitting, or lying down on their side, for example, these directional terms are universal and applicable, so we're able to pinpoint the specific location of a body structure. This allows for clear communication among healthcare professionals, helpful in diagnosis, in charting accurately, so accurately identifying the location of pain or of an injury, for example, and also helpful, of course, for surgery, research. All fields of healthcare are relevant. So in the medical field, directional terms are needed for describing the relative location of different body structures, particularly in relation to one another. So what this means is these directional terms help us to pinpoint the location of one structure relative to the location of another. So if we know the location of one structure, we can then identify or describe the location of another relative to it. And we'll give some examples of that shortly. But these terms are really useful in communicating, therefore, the location of wounds, injuries, tumors, pain. These terms are widely used in healthcare to accurately pinpoint the specifics of a particular condition relating to a patient or a structure. Now, these terms are used relative to what's called anatomical position. So in order to create a common reference point for the way that we use these terms, we use all these terms relative to or referring to someone who is in anatomical position. An anatomical position looks like this. So an individual standing forward with their feet shoulder width apart and their palms facing forward. This is really important. So you can see the palms are not back, the palms are facing forward. And this is relevant when we start to introduce some of these terms. So I'm going to start with lateral versus medial. So the word medial refers to towards or at the center line of the body. So anything medial is towards the middle or center. Lateral refers to the sides or away from the center line. The reason why anatomical position is so important to consider as a reference point, if we think about if our palms are facing forward as they are in anatomical position, this individual's pinky, we would say, is more medial or is medial to the thumb. And we would say that the thumb is lateral to the pinky. So if something is farther away from the midline relative to something else, we say that it is more lateral. If something is closer to the midline, we say it's more medial. But see how there's always a reference point or always something, another structure that we're comparing to here. You could also say the medial surface of the arm. The medial surface of the arm would be the one that is closest to the midline when you're in anatomical position. So that would be like here, kind of the side of my arm on the medial side. And when I put my arm at my side. The lateral side of the arm would more be referring to my tricep muscle, for example. So farther away from the midline. Other directional terms that we use, excuse me, sorry, I'm just gonna have a drink of water. Other directional terms that we use is distal versus proximal. Now, distal and proximal are commonly used when we're talking about the limbs of the body. And so distal refers to farther away from your center or from your trunk, the center of your trunk. And proximal refers to closer to your center of gravity. And so we would say that our hand is distal to our elbow. And our elbow is distal or farther away, or farther distance, distal to our shoulder. Alternatively, you could say your shoulder is proximal to your elbow. So proximal refers to a structure that is closer to the center of gravity, and particularly with respect to the limbs. And we can say the same thing for a leg. So we could say that the foot is distal to the knee, and the knee is distal to the hip. Or we could say that the hip is proximal to the knee, and the knee is proximal to the foot. So see how we can say in the reverse, and it's all relevant to the reference point. So the knee is proximal to the foot is distal to the knee. It's all relative. Now that's proximal and distal. We also have other terms, superior and inferior. Again, related to a person in anatomical position. Superior refers to towards the head region or above, and inferior means below. So your belly button, say, is superior to your hip, or your hip is also superior to your knee. So this becomes relevant, including the limbs when we're talking about above and below. You could also say that your stomach, which would be up here in the abdominal cavity, your stomach is superior to the appendix. The appendix is in the lower right quadrant here of your abdomen. So the stomach is above or superior to the appendix. You could say that your collarbone is superior to your stomach. And you could also say that the stomach is inferior to your collarbone. So directional terms matter and reference points matter. And as always, the reference is referred to as someone who's in anatomical position. Now, some other terms can be used that allow us to indicate direction regardless of the position that the person is in. And so the terms cranial and caudal. Cranial refers to the head, cranium referring to the skull, and caudal refers to the tail region. And so if someone is lying down, for example, you might use the word caudal to describe a structure that's closer to the tail region or an injury or a wound. That's more caudal. This would imply closer to the tail, versus cranial would be something that is closer to the head region. And again, we can see from the side, anterior versus posterior. So structures on the front surface of the body or towards the front are more anterior, and towards the back are more posterior. And we'll see the body cavities and what internal structures are anterior versus posterior shortly. Another position that we may refer to is an individual who is supine or prone. Supine and prone refer to horizontal positioning. So if someone is lying down, an individual is prone if they're lying on their stomach. We can see here this individual lying on their stomach is prone, and supine refers to an individual lying on their back. So for example, heart surgery might be conducted on an individual who is lying on their back, and surgery of the spine might occur on someone who is lying prone. Hey, so I think I'm going to pause this video here, and in the next video, we'll continue with the directional terms and positioning.